Alright, so now I'm going to do my IV Minibag, and first I'm going to make sure, implement my standard protocol and make sure that I have the correct medication, the correct dosage, the correct route, and the correct frequency. And the doctor ordered for Miss Jones vancomycin, and I would check my drug and make sure that, that I know the action, the purpose, the dosage, side effects, contraindications, infusion time, and the implications. And I'm also going to check my patient's record and check any allergies or data that might be important to know. Okay, so the doctor ordered vancomycin, and the order is for 250 milligrams IV Q24 hours. And on my medication vial, it says 500 milligrams per milliliter. So that would come out to be 2.5 milliliters. And to find my drop factor, my bag says 10 drops per milliliter on my IV tube bag. So that would be 2.5 over 60 minutes times 10, which is 0.416. So that would be 42 drops per minute. Okay, so now I'm going to prep my medication. I'm going to draw up 2.5 milliliters of the vancomycin. And I'm going to take my saline bag and just clean this port. And now I'm going to inject the medication. And this goes into the sharps. Now I'm going to gently rotate my medication bag to mix the medication. And now I'm going to attach my tubing. First I'm going to attach a needleless device. Make sure my tube is clamped. I'm going to spike my medication bag. And now I'm going to prime my medication bag, my tubing. And my tubing is primed, so I'm just going to clamp that back up. I'm going to stick the end of the tube back in the bag just to keep it clean before I go into the patient's room. Now I'm going to draw up 6 milliliters of normal saline solution. And before I go into my patient's room, I'm going to label the bag with the client's name, the drug, the dosage, the time, and my initials. I'm also going to label the tubing with my initials, the time, and the date. Okay, so now I'm ready to go into my patient's room. Hi, Mrs. Jones, how are you?
Fine.
Okay, your doctor has an order for you to get vancomycin. Have you had this medication before?
Yes.
Okay, it's going to go through an IV. So, can I get your full name and date of birth?
Eleanor Jones, 5795.
Okay, and do you have any allergies to this medication or any allergies I should know about?
Nope.
Okay, any allergies at all?
No.
Okay, great. So we can get started. Okay, and I'm just going to check your IV site. I'm going to wash my hands first and apply my clean gloves. Okay, and I'm just going to check the IV site for phlebitis or infiltration. I would know that it's phlebitis from heatness, redness, swelling, or pain. And I would know infiltration from wetness, coldness, leakage, or paleness. Okay, so everything looks good. So I'm just going to clean the port really quickly with an alcohol pad. Okay. And I'm going to flush your IV. Make sure it's unclamped. And I'm going to flush using the ASASH procedure, which is administer saline, aspirate saline, administer saline heparin. And the heparin would only be used if an order was written for a dose of heparin to flush a central line or a PICC line. So I'm going to aspirate, and I see a blood return. So I'm going to administer a push stop of saline, 3 milliliters. Okay. And I'm just going to clean the port one more time. And now I'm ready to connect my tubing. Okay, and my tubing is unclamped. And now squeeze my filter chamber, and I'm going to establish a drop rate, which we figured was 42 drops per minute. And I would wait and count that out. So I have 42 drops per minute. Okay, and then I would continuously check Mrs. Jones for any phlebitis or infiltration or any concerns that she had. Okay, so now I would leave the room, wash my hands, and Miss Jones, how do you feel?
Fine.
Okay, so now her medication is over, it's finished, so I'm going to come back, and again I'm just going to check the IV site for any phlebitis or infiltration, and that looks good. So I'm going to clamp the INT while removing the needleless device. And this is an old one, so I'm going to throw this one away. And I'm going to put a new needleless device on for the next nurse. And I'll leave it in this wrapper that it came in so they know it's new. And my medication, my tubing is dated, initialed, and time. Okay, so now I would document that I'm going to, but before that I'm going to flush my IV. And I would flush using the push stop method of 3 milliliters. Okay, and I am clamping as I am removing the needleless device to establish positive pressure. Okay, and now I'm done. And I would dispose of all my needles and syringes in the appropriate containers. I'm going to monitor the IV site for edema, pain, tenderness, redness, or any allergic or adverse reactions. And I'm going to document the use of my MAR, the time, drug dose, and route of the medication, the state and condition of the IV site, and I'm going to document in my input and outtake. And that's it.